Okay, this is Josh Halls for FNP 597. SOAP note. Client's, the patient's initials are AW, age 87, Caucasian male. Date of birth is 1/1 of 1935. The patient presents with his wife and his son to help just in case the patient is having a hard time remembering or needing some clarification. The chief complaint is that the patient and the family members state that his memory seems to be getting worse. The wife states that it is a rapid decline. The confusion started about last year when the patient came in with a possible urinary tract infection. The urinary tract infection was cleared up by an antibiotic. However, the confusion seemed to remain and steadily get worse. So between Alzheimer's and dementia and possible urinary tract infection, the patient also has an open wound on his left foot that is being taken care of by a wound clinic, and so could possibly be an infection there that is also tying into the confusion. The wife again states that it's a rapid decline in his memory. They did get a referral to a neurologist. They went and were very unimpressed with how they were treated, but they gave him 2 medications, memantine extended release at 28 milligrams and donepezil for 10 milligrams. But they feel like that isn't really helping, and they feel like they weren't really taken care of as well as they were hoping at that neurologist. So we'll talk about that at the end with our plan of care, but getting them a different referral to a different urologist in hopes that they can feel like they're being better taken care of. Patient also has type 2 diabetes, and patient's family are afraid that if the patient with memory loss will forget to check his blood sugars, and they are worried that his blood sugars will slowly rise. His A1C was checked today in office, and it was 6.6, which is great. We want it under 7, and that's phenomenal. The medications he is on is a metformin 1,000 milligrams and a atorvastatin for his hyperlipidemia, 80 milligrams. His past medical history is pretty extensive. He's had a history of bronchitis, contusions, back pain, chest pain, cellulitis of the foot, sleep apnea, coronary artery disease, gout, hypertension, hyperlipidemia, and type 2 diabetes, and urinary tract infection and vitamin B12 deficiency. He does have allergies to penicillin. Medications that he is currently on is allopurinol, 300 milligrams to prevent gout, atorvastatin calcium, 80 milligrams at bedtime, calcium with vitamin D3, carvedilol, cyanocobalamin injections, donepezil, lisinopril, memantine, metformin, and tamsulosin. His family history is that his grandparents and parents both had hypertension, and both of his grandparents had type 2 diabetes. His parents, he doesn't think so, but he remembered that his grandparents both did. He's been married and only sexually active with his wife. They do have insurance through Medicaid. The patient and the wife claim that they are both no longer sexually active at this current time due to their age. Chemical history: patient denies ever using or drinking any alcohol, smoking any cigarettes, vaping, or trying any illicit drugs. His patient claims he exercises daily with his wife. They go for walks. And surgical history is unremarkable. The facility didn't have a history of it, and the patient couldn't really remember, and due to time, we didn't take a lot of time to go through a surgical history. He is claimed to be up to date on his immunizations. His review of systems, everything checked out, was pretty normal. According to him, seems to be doing pretty well. Vital signs: heart rate of 57, temperature of 36.4, blood pressure of 117/60, respirations of 16. On room areas at 99. And pain 0 out of 10. So other than this confusion and wound on his left foot, seems to be doing pretty well. As a physical exam, no apparent stress, no fever, no chills. Cardiovascular had a regular rate, no gallops, bruits, murmurs, auscultated Pulses are 2+. Respiratory rate, breathing was not labored. Lungs were cleared upon auscultation. Neurological was grossly intact, and psychiatric, he was oriented to person, place, and time, and with the normal speech and comprehension. He even remembered the 3 words that the MA gave him at the beginning when the MA brought him back to the room. So for differentials, we're thinking of confusion, Alzheimer's, dementia, and possible infection, along with his diabetes. That he's got diabetes type 2. So for the plan of care, we're going to up his donepezil from 10 milligrams to 23 milligrams orally and see if that helps with his memory loss. If it doesn't, we want the family to come back as soon as they can or as soon as they notice, so that we can get him another referral to a new neurologist in hopes to help get him in the right situation to where we can stop or slow the progress of dementia and confusion. Yu et al. States that there's an article that was done that's focused on exercise for memory loss and confusion and dementia, and it stated that exercise and a Mediterranean diet can be the best things that people can do to help slow that dementia state of mind. So that is one thing we discuss with the patient, is making sure that he does continually exercise, get out and walk, which he says he does with his wife. And then there's another article by Liu et al. And all his colleagues about donepezil and how it's kind of the new up and up medication, moving up and up on the list for confusion and dementia due to its effects on memory loss and slowing that process of the dementia. Again, our biggest fear for this patient is that he will not be able to be checking his blood sugars daily. So we want to get him the Libre Freestyle 3 so that he can get it to his wife's phone and she can be the one monitoring his blood sugars. The patient is very dependent on the wife, and she is very capable of taking care of her husband. With an A1C of 6.6, we'll follow up in 3 months to recheck that blood sugar levels and to make sure that they have gotten all the necessary things for blood sugar checks, being able to do that on their phone. They know that they can return at any time to the clinic if they have any questions or concerns. And that is a soap note of my 87-year-old gentleman.